Hi, it's so great to meet you. I'm the student nurse who will be examining you today, and you're just here for a checkup, right? Perfect. Well, I really appreciate you allowing me to do this exam. So I do need a few pieces of information. So I know your name, but can you confirm your date of birth? Okay. And any current medical issues? And what about any past medical issues that you've dealt with? Okay. And when was your last checkup? And then are there any medical issues that run in your family? Okay. Let's see. And then what is your diet like? Okay, so what about fruits, vegetables? Do you drink caffeine? Do you have a history of high blood pressure? Good. And have you been sick recently? Okay. Good. So I think we can get started. So I'll start by taking your vital signs. And let's do your temperature first. So that'll be simple. Just need you to put this thermometer under your tongue. So just open wide. Very good. Just put it right under your tongue. Perfect. And just keep your mouth closed tight. Good. Should be all the way under your tongue. Okay, and then I'm just going to wait for it to go off. Okay, let's see. Okay, so your temperature is normal. And that makes sense since you are not feeling sick. Just going to take a note of that. And I will be taking a little bit more notes than you might be used to, since again I'm practicing. Sure. So let's see, next I will do your heartbeat. So I'm just going to get my stethoscope. And just going to ask you to take a deep breath and then hold it for me, okay? I'm going to put this on your neck. Okay. So, deep breath in. Good. And one more. Good. And deep breath in. Good. I'm just going to put this on your chest. Deep breath. You can let it out like normal. Yeah. Good. Deep breath. Good. And one more. Good. Okay. So I didn't hear anything abnormal with your heart. And you said that heart issues don't run in your family, right? Okay, good. So I'm going to move on to the blood pressure. Do you have an arm that you prefer me to do it on? Okay, so I will do your left then. So I'm just going to ask you to slide your arm right through here. Perfect. And then you can just relax your arm. I'm just going to stick this part right underneath. Okay. And now this will just get pretty tight on your arm. And then I will release it. Alright? So you can take your arm right now. Just gonna set this over here. So your blood pressure is 120/80, which is normal. And again, high blood pressure doesn't run in your family. Okay. So let me put heartbeat normal and blood pressure 120/80. So let's see what's next. Guess I will examine your head next. So first, I'm gonna just use my flashlight here. Just gonna take a look at your skin. So you can just look straight ahead at me. Perfect. And let's see. So, how often do you go to a dermatologist? Okay. Yeah, your skin looks pretty good. No bumps, nothing painful recently. Okay. Yeah, I don't see any abnormalities, so that's good. Just notice you have a little dry skin. Is that normal? Yeah, I mean it is winter, so it's pretty common. Alright, so I'm gonna now just check for any drooping or any pain on your face. Can I touch your face? Okay. Just gonna gently touch. I don't see any drooping and any pain on the side. A little jaw pain. So that can be caused by TMJ. Do you grind your teeth? Yeah, so do I. Have you talked to a dentist about it? Okay. Yeah, I know sometimes you can get a retainer to help, but sometimes they don't work. If you need more advice, I can definitely write you a referral. One of my friends is an oral surgeon and can definitely help with those issues if you need it. Okay? So just open your mouth for me wide. Good. Now close it. Good. Now can you open one more time? Look at your throat. Okay. Lift your tongue. Say ah for me. Good. Okay. And I just want to feel your lymph nodes for any inflammation. Okay. All feels good and no pain again. Good. So, just take a few notes. And then I'm going to do a quick eye exam, not a full eye exam that you would have with an optometrist, but just checking a few things. Do you wear glasses? Okay, contacts. Alright. So let's start off by checking your pupils. Just going to dim the lights a little bit, okay? So just look straight at me, right at my nose. Good. And I'm just going to make sure your pupils react to light as they should. And you can keep blinking, that's fine. Okay, now can you just follow the light for me? Very good. Perfect. Now for your peripheral vision, I think. Let me make sure. And am I doing a good job so far? Okay, good. Just checking, I am a little bit nervous. I think it definitely takes some time to feel confident. But I'm sure after doing many of these exams, I'll feel better. So your peripheral vision. So you're going to look directly at my nose again, and then just tell me how many fingers I'm holding up, okay? Here we go. Good. 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 Okay. I'm going to have you cover your right eye first. Good. And hold this right here and ask you to read this line for me. Good. And what about this one? Good. Can you read this one? Very good. And then what about this one? Very good. And let's switch and cover your left eye for me. And read this line. Good. This one. Good. This one. Good. This one. Good. Okay. Do you typically have dry eyes in winter? Yeah. Okay, I might give you some drops just to take home if you want to use them. They'll be really helpful for bedtime when you sleep. Kind of make your eyes feel refreshed when you wake up, so just make a note of that so I don't forget. So eyesight 20/20, pupils good, peripheral vision great. Dry eyes. So now I'm going to check your reflexes. So can you just stick your arms out for me? Good. Then I'm just going to push down and I need you to resist. Okay? Push, 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 push. Okay, good. And then I'm also going to push on your legs. So So just resist for me. I'm gonna push, push, push. Okay, good. Good job. Now, can you tilt your head back for me? Yep. And now tilt it forward. Good. And then right. And then left. Good. Okay. No pain. Okay, what about when I was pushing down on your legs and arms? No pain. Okay. I forgot to ask you about your fitness. So, do you exercise a lot? Okay. Okay, that's pretty good. And what do you do for work? Okay, so you are moving around a little bit. That's good. So, just two more things. I guess let me first check your abdomen. So I'm going to have you lean back a little bit. Good. And then I'm just going to push on your abdomen and kind of do a light tap. And I just need you to tell me if you feel any pain at all. Okay? Alright, so let me start on this side. Any pain? Good. Okay. And now to this side. Pain? Okay. Yeah, usually if a patient does have pain, they will jump, or I can tell if they have discomfort, but I always ask just to make sure. So, abdomen. And the last thing I'm going to check is your ears. Again, not a full exam. Just want to take a look inside. And I actually forgot to ask about your ears. So, do you ever have trouble hearing? Okay. And have you ever had your ears cleaned? Okay. Yeah, that's fine. Not everybody gets that done, but definitely something to think about. So I'm just getting my otoscope ready. And all that is this right here. It will allow me to see your eardrum, make sure there's nothing going on that shouldn't be. So, can you just tilt your head for me? Good. Just gonna take a look first in this ear. For redness, any inflammation. Okay, it looks good. And then tilt your head again. Okay. Okay, no redness, no inflammation. Eardrum looks good. I do see a bit of wax, but nothing too crazy. So yeah, I can actually ask the doctor for a recommendation. I think it might be best to maybe get your ears cleaned. Nothing that needs done right away, but it might be a good idea for the future, like I said. So I'm making a note for the doctor there. And then just one more thing. So I'm going to assess your cranial nerve 8. So I'm going to have you cover one ear. You pick whichever one you want. And then I'm just going to whisper a few numbers on one side at a time. And you just tell me what they are. So let's begin. 13, 45, just going to do this side. 55, 6, 81. Good. 99, 13, 42. Okay, good. So, did you struggle at all? It didn't seem like it, so I think you're good with your hearing. Although, of course, we would suggest that you get a full hearing exam once a year. Let me just make sure I've checked everything. So, your ears are good. Perfect. And, the dry eyes. So, let me see here. I know I have some. Here it is. Okay, so this is what I use. And I think the doctor would probably suggest this as well. So, this is a night gel, comforting dry eye relief. And let's see the directions. Put 1 or 2 drops in the affected eyes as needed. So I usually just put 2 drops on the lower part of my eye right before bed. I will say it feels a little bit odd since they're gel-like, but they really help me sleep with dry eyes. I used to wake up in the middle of the night and feel kind of itchy and irritated, so here they are. And I think we are all set. Now, do you have any questions for me? Okay, good. So I'm going to speak with the doctor right after this to just give my notes, and if he has any questions or needs information from you, he may reach out with a phone call. I'm glad you are in great health, and you can check out at the front desk. Alright, well, take care and be safe.